Hello there. Welcome to our Chiropractic Clinic. How you doing today? I see. Well, I hope by the time you leave our office, you feel even just the littlest bit better. I'd love to start with an assessment, because this is the first time I'm seeing you, right? Yes. So we're going to do a full body assessment to just see where you're at and see where I can help you, where we might see some improvement. And I'm going to use a special tool, actually a set of them. So this is our big guy. This, as well as my other tools, are called goniometers. And what we use these for is we can measure a joint's range of movement, more specifically the degrees. So it's like a joint protractor, for example. So we've got a real big one for the elbow, for example. We have a medium-sized one right here. You could go all around. And we have a small one, so we could use this, for example, for the wrist and measure our angles this way. It'll be a little easier to show on you rather than on me. So let's start with the head and neck. I'm just going to look at the head-neck relationship here. And I want you to just relax down a bit, okay? Yeah, that just shows me a little bit about how your body consolidates itself as you kind of pull yourself inward a bit. Okay. It tells me, for example, if one side is a little more crooked than the other. Just gives me a couple of clues about what's going on. So, can I have you just move your head to the side? The other side. Okay, up, down, and your left, your right. Okay, good. You give your shoulders a couple of shrugs. Very good. And let me see the arms here. This is where we bring in our goniometer. So I'm going to have you just hold still here, and can you just open your elbow as far as it'll go? Okay, it stops right about there. Let's see. Okay, that's within normal limits. The other side. Just going to line this up. The upper arm, and if you could open up your elbow right there. Okay. Alright, so that one certainly is a little more hypermobile than the other one. Now, let's see the wrist. And we're just going to use the little guy for this. Can you put your wrist down? Good. And can you cock it backwards? There we are. Okay. Those are some good values. And how about the other wrist here? So let's go backwards. Okay. That's about the same. And forwards. Just lining this up with our hand mark here. Okay, and that is, yeah, that's pretty much the same too, which is good. So, let's just look at the shoulders to the hips here. Okay, so just right in front of me here, I can see that one hip is higher than the other, which is pretty common. And that is going to make your legs different lengths. So that is something that we're going to want to keep an eye on. And I'm just going to do your knees real quick. So let's get our tool. Can you bring your knee in as far as you can here? Yeah, just as you're sitting here. Okay, and kick out. Good. Other side, bring it in. And kick out. Okay. Was there any pain or restriction with that? Okay. And how about the ankles here? So line this up with the leg here. Can you bring your ankle up or your foot up? Good, and down. Okay, that looks good. Other side, bring the foot up. Okay, and down. Yeah, no, I think that's quite fine. So, a little more hypermobile in just this one joint over here, which that's something we'll just keep in mind. Would you mind just turning around so that I can take a look at your spine? Okay, so let's see here. All right. So we have atlas, axis, T1's little notch here. Good. Okay, so there's maybe a couple little twists here in a vertebra or two. Lumbar, sacrum. Do you have any particular pain in your back at all? Okay, just occasional. That's good. Right, let's look at your shoulder alignment. The back here. And the hips. Yeah, we've got one of them's a little cockeyed. So we'll get that all taken care of. Alrighty. Would you mind just bending forward and then vertebra by vertebra coming back up? I just want to see each vertebra in action. Okay, keep going. We're looking for signs of scoliosis, and in a moment I'll look for kyphosis and lordosis issues. That looks good. So let's just look at the profile here. So while scoliosis is your spine having abnormal curvature, generally in a lateral direction, kyphosis and lordosis is whether you have an issue with the spine, you know it's an S shape. Well, are one of those curves too curved or not enough? That's what we want to check just right in here. Looking at the profile of the spine. Which no, it all looks pretty normal, which is good. So no scoliosis, no issues with lordosis or kyphosis. So what we want to do now, I'm going to get you to lie down face up to start, and we'll do some adjustments. We'll start at the feet, work our way up, and then we'll kind of bebop around a little bit. Okay. All right, so I'm going to have you get set up on the table, and I will come back in a minute, and we will start the adjustment. Are we comfortable here? Okay. I'm going to be down here for a little bit. We have a few adjustments to do with the legs, knees, hips, feet, toes. So I am going to have you breathe in and breathe out with each adjustment. And I'll tell you when you can do that. But we're going to start very simply with the toes. So I'm going to have you take a deep breath in and out. Okay, deep breath in and out. Good, deep breath in and out. Deep breath in and out. Last toe here, deep breath in and out. Okay. We got a little bit of cracking with those. So now we're going to do the midfoot here, or the forefoot. So I'm going to do the outside first and then the inside. I'm going to have you take a deep breath in and out. Okay. Deep breath in and out. There we go. I am going to be doing a little bit of kind of a traction pull here. So I'm actually going to have you take your arms, bring them behind your head, and hold on to the edge of the table, okay? There you go. So you're going to want to hold on just because I'm going to be pulling you, and I don't want you to come sliding with me. Just take the leg here and just get a little bit of ease in here. We're going to take a deep breath in and out. There we are, just like that. Now, we're going to do some work with the knee and the hip here, as well as the foot. So let me get you into position. We're going to come right about here. So, deep breath in and out. Okay. Knee, foot, put the leg out to the side, hand over here, and just like that. we are going to stick with one side of the body to start, and then we can mirror these adjustments on the other side. But for now, I'm going to come forward and we're going to work on your back a bit. So we're going to get into the thoracic region of the spine. So to do that, I am going to have you put your hands on each shoulder here. And then I'm going to have you lift up the head so that I can put my hand under there. Okay. Just relax back into my hand. Okay. I'm going to pull you forward a bit. Okay. Then I can reach underneath here and get to the spine. So I'm going to have you take a deep breath in and out. There we go. So that was 3 adjustments on this side, and that's the mid-thoracic region there. So we are going to keep your arms crossed over on your shoulders here, and I'm going to kind of lean over you here, but let me get my hand into position under your back. And this is going to be for the upper thoracic region here. So I'm going to have you take a deep breath in and out. There we are. Okay. Let's just pause for a moment. Especially with that back work where, you know, we're used to seeing people that are lying on their abdomen and you see the back work. It's a little different when you're facing up and it's a little opposite. So we'll give your body just a second to process through all of that. And then we are going to do some work on the cervical vertebrae. So I am just going to take your head here. Okay. So I am going to just turn your head this way. And we're going to come back a bit. Okay. We're just positioning. I'm going to have you take a deep breath in and out. Good. Okay. Alright, let's bring you back to neutral. Okay. We're going to do that to the other side. So, turn, come back. Alright. Deep breath in. We'll give that a second. Some neck work can be a little daunting. The head is not generally used to going so fast. So we'll just give you a second so that any dizziness you might have had just dissipates a little bit. We are going to be doing something similar to when we were down here, when we pulled on the leg, but this time we're going to work on the base of the skull here. We're going to do a little pull from there. So I am just going to take your head here, and I'm going to have you just relax. I am going to have you take a deep breath in and out. Okay, just like that. Nice and easy. let's go ahead and move your arms around. And I'm going to take this arm right here and just shake it out a little bit. Okay, so what we want to do here is we're going to work with the elbow, the wrist, and the fingers. So I'm going to hold the elbow and your hand, and we're just going to do a couple adjustments at a time. So deep breath in and out. Elbow, wrist, and then we'll do each finger. So deep breath in, out, thumb, okay? And then we're going to do these distal joints here. So deep breath in and out. Press, press, press. Okay. And you can just keep that at your side there. So I am going to have you put your arms above your head again. And I am just going to adjust your ribs here. So we'll do 3 times on the ribs. And then I'm going to take my hands and adjust the sternum. So deep breath in and out. Good. And then sternum. Okay. So let's go ahead and move on to the other side and get that mirrored in adjustment to this side. So like the other foot, we are going to start with the toes. I'm going to have you take a deep breath in and out. 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 Last one, deep breath in and out. There we go. Take another deep breath and then we can get the midfoot here. Deep breath in and out. There we are. I'm going to have you grab the top of the table again, and we'll shake this out a little bit. And I can have you take a deep breath in and out. Okay, just like that. And then we are going to get our knee, foot, and hip. So let's just get you into position here. Okay. Deep breath in and out. Okay, so I'm going to come up a little closer and then we will work with the back and the arms and the head. Let's just put this arm on this shoulder and this arm on that shoulder there. I am going to put my hand underneath here, and if I could just have you lift your head. Good, and lay back down. Pull you forward a bit. Okay? So I am gonna do 3 adjustments here. So take a deep breath in and out. Good. 1. Okay. And give that a moment. Good. So, I put my hand under your back here. We can get the upper thoracics. So deep breath in and out. Okay. So we don't need to have the arms crossed anymore. Just put them to your side. And then from this side, we're going to work with the neck. So we're going to turn the head this way. Come back. And I'm going to have you take a deep breath in and out. Good. And turn this way. Deep breath in and out. Okay. There we are. We're going to do one more pull. So deep breath in and out. There we go. Okay. So I am going to work with this arm now. So shake it out a bit here. And then bend the elbow like this. Deep breath in and out. Elbow, wrist. Okay, and the fingers. Deep breath in and out. 2, 3. Good. And I'm just going to roll these and deep breath in and out. 2. There we go. Okay. So if I could have you put your arms above your head again, and we'll do the ribs from this side, and we'll get the sternum again. Deep breath in and out. Good. There we are. So let's go ahead and get you sitting up. We'll do a few adjustments and then we'll flip you over. I am going to have you put the backs of your hands together, but just in front of you, just like this. I'm going to essentially hug you around the shoulders from the side here and kind of pull you together. So if you could just put your arms out in front of you, backs of the hands touching. I'm going to just come around here and hold here. I'm going to have you take a deep breath in and out. Okay, so now I'm going to have you lift your arms above your head with your hands still, backs of the hands still touching, and we're going to do that again. Okay? Go ahead and just take a deep breath in and out. Okay. Let me scooch to the side here. And you just stay there. And we're going to come from this side. So, deep breath in. And out. Good. Lower the arms down so you're back in that starting position. Okay. Deep breath in. And out. Okay. Let's go ahead and get you lying face down on the table. We'll do a little work on your legs, and we'll do a little work on your back. So from here, I am going to pick your foot up here, and we're going to do a little adjustment with the knee and the foot here. So what I'm going to have you do is just take a deep breath in and out. Okay. And then, alright. There. Very easy with the leg there. Now we're going to do kind of a twisting adjustment here, where I am going to have my hand right underneath here, so on the anterior hip, while I have a hand on the upper back here. And we're going to do this 3 times. We're going to have 3 adjustments here. I'm going to have you take a deep breath in and out. There we go. I'm going to have both my hands on either side of the spine here, and we're going to work our way down to the mid-back. If I could just have you take a deep breath in and out. There we go. Even got the table involved a little bit. Alright. So I'm just going to put a hand on the back of your head and one of my hands on the upper back, and we're going to do a bit of a twist here, okay? So, deep breath in and out. There we go. Okay. Let's go ahead and move to the other side, and then we'll get some more sitting up adjustments. Then we've got our leg adjustment here. So we're going to come right about here, and I'm going to have you take a deep breath in and out. Good. Reach across here and come under the hip, and we're going to do a twist adjustment here. Deep breath in and out. Okay, so now we'll start at the upper back, and deep breath in and out. There we go. Give that just a moment, just to process, and then we'll do one last little twist adjustment while you're lying down like this. Okay. So deep breath in and out. Okay. So, I'm going to have you sit back up. We'll do a few last adjustments and get you on your way. Last set of adjustments here. We are going to be primarily focused on the head and the neck. So I am going to come up here and I am just going to have you move your head just like this. And I'm going to have one hand on top of your head. And we are going to do a little move here. So if I could have you take a deep breath in and out. Good. And just back to neutral here. Okay. So this time I'm going to twist around here so my forearm is along your face here with my hand on top of your head. Once again, we're going to have you just bend to the side here. I'm going to have you take a deep breath in and out. Good. Okay. Just hang out for a moment. Couple of breaths. Just like that. And then I'm going to position you so that we are right about here. Okay? And we're going to take a deep breath in and out. Okay. So, that was kind of a lot. Let's just hang out for a second. And let's see what we've got going on here. There, we'll put you right there. That a little bit better? Yeah, okay. So, we'll do those same moves on the other side, and we'll just check out how that was doing. So, let me get up here on this side. So just like the other side, we're going to bend you this way. Now have one hand on top of your head. You could just take a deep breath in and out. Good. Okay. And then let's go ahead and twist around here. So, forearm along the face. We're gonna drop the head. Okay. Take a deep breath in and out. Good. Back to neutral. Take a second. Okay. Drop the head back. Turn a little bit. Deep breath in and out. Okay. Alright, let's just set you up right here for a second. Get my seat. Okay, so not quite like that, but like this. There we go. Right, so let's just take a little look here. Make sure everything is even. Everything looks aligned. Okay. So certainly the shoulders Let's look at the hips. That's definitely better. Definitely better than what we had before. That's something we can keep working on. And let me see the arms. Just give some movement all around. How does all of that feel? Pretty good. Okay. Everything looks great. Let's look at your head a little bit. Back, forth, side, side, lateral, lateral. There we go. All right. So, we've done quite a bit of work on you today. Essentially a head-to-toe adjustment and revisited some places quite a few times. How are you feeling? Okay. Things are going to be a little strange to start out because we have done quite a bit of adjusting and the structure of your body has changed a little bit. It'll take maybe a couple days to get used to, but then after that I imagine you'll feel a lot better. So we would probably, ideally, keep doing this twice a week to start out, just because some of those adjustments we need to keep reinforcing or they'll just go back to the dysfunction they were before. So otherwise, we could do once a week and do that for longer. It's really up to you. But eventually we'll get to a place where it's just maintenance. It's just once every couple of weeks, once a month, things like that. Okay? All right. So, anything else I can do for you? Okay. Well, it was wonderful meeting you. And I look forward to working with you. I hope you have a whale of a day and a good rest of your night. Thank you. Hello there, and welcome. As I understand it, you're looking for a bit of an adjustment. Is that correct? Okay. Well, I'd love to start by just taking a look at you and getting an idea of maybe what we can do to help you out. Is there anything specific that you're concerned about? Any specific pain, dysfunction? Just taking a look at the different relationships in the body. Okay. Just looking at how the head and the neck are working together. Shoulders and the neck. Arms and the shoulders. So on and so forth. Okay. So, I see a few things off the bat, but we're going to go a step further and do a little bit of testing just to see what exactly is going on. And I'm going to start with the head. So I am going to hold on to your head and I'm going to move it around a little bit and just see what's going on in the vertebrae and if there's any restriction, anything like that. So I'm just going to have you just let me take the weight of your head. There we go. There we go. Now, let's just go ahead and move your head back. Okay, that's not quite on center, is it? Let's try that shoulders a little bit. Maybe an impingement. Maybe some kind of muscle tightness there. So why don't we bring this forward? Okay, and that's straight on. Right, and again. Yeah, no, that's just fine. Okay, let's turn your head this way. Just kind of the way that your head this way. Your head was kind of leaning towards this way and this way. Okay, I'm going to tilt your head just like this. Yeah, that looks fine. How about right in here? No, that is too. One more time, just tilt this way. Okay, and how about right in here? Good. I'm going to try to move your head backwards again. Yeah, no, it's got that little bit of a twist to it. That is a little odd, but that's certainly something we can work with. Let me just take a little peek here. Just look at the vertebrae here. Okay. Feel a little bit. There's a little bit of a twist there, and the muscles are pretty tight. So that's certainly something we'll want to hone in on, absolutely. Now, let's take a look at the shoulders here. So, I am just going to roll the shoulders a bit if I can. Might be a little awkward. Just picking your arm up a bit and trying to get movement and back. Yeah, that's pretty tight. The other side here. I know it's hard to kind of let go when you're sitting up. It's a lot easier laying down. So we'll do a little bit more of a look later on. Just kind of poking into the rotator cuff muscles here. Okay. Maybe a bit on that. Let's look at the arms. So, more specifically, the elbow joints here. Is any of this painful? Okay, I'm just kind of palpating around the tendons here and over here. Okay. Can you just bend your arms in and out for me at the elbow? Any pain or tenderness with any of that? No? Okay. Can I see your hands now? I'm going to just palpate around the wrists and the joints of the fingers. Okay, nothing too bad here. Alright, so maybe just a little tune-up with those, just to keep them in good shape. Now, I'm going to look at your spine and the sacrum, the hips in a moment, but I want to take a look at the knees and the feet while I'm facing you here. So, as I palpate around the knee, any pain or tenderness here? Slide. Okay, so no pain pain or tenderness here then. Alright. Would you mind just popping your feet up on my knee here so I can take a look? Okay. Now, the ankle here, if I roll the foot around one way and the other, is this painful at all? No, you've got good range of movement here. If I squeeze the toe joints, any pain? Okay. And if I poke around on the soles of the feet, okay, they are a little swollen as well. Okay, now the other foot, again, same thing. I'm just going to roll the ankle around. Get a little bit of cracking. That's normal. And toes. That's okay. Okay, and soles of the feet. Alright, not very nice. Yeah. Okay, well, we can certainly work on that as well. Now, I'm going to have you shift around so that I can take a look at your back, that I can look at everything from the cervical vertebrae to the lumbar, and then we'll get into the sacrum as well as the hips. Okay, so let's start by looking at these neck vertebrae. So, have you had any sort of injury at all? Or maybe overexertion, overuse of these areas in an incorrect manner? For example, if you have your head quite pitched forward for a long time, if your neck's bent a lot. Okay, and just keeping along the line of the spine. Okay, so certainly got a few vertebrae that are a little twisted. And I'm gonna want to see if maybe one side is higher than the other. I'll do that in a moment. So as for the sacrum here. Okay, if I press in here, is that, yeah, that's pretty tender. Okay, if I come along the iliac crest here, along the pelvis, how is that? Okay, so in towards the middle is more painful. As I go outwards, less so. Okay. I'm gonna hit a spot that's probably gonna be pretty tender. Let me know if it is. Yeah, right in there. Yeah, this is an area. I have some pretty annoying sciatic pain myself, so that's an area that if you dig in a little bit, if you have that sort of issue, it can clear up a bit. But we can certainly work with that. We can get a little bit more space in here so the nerve's not as compressed. And let me see the hips. I just want to see the alignment here. Yeah, we've got a bit of a tilt. How about the shoulders here? Yeah, a little bit of a tilt. Okay. Let's check the scapulae. So, no winging here. And, yeah, they sit normal on the body. Okay. Last test here. I'm going to have you bend forward as far as you can. And then you're going to come up very slowly, almost vertebra by vertebra, okay? That way I can get a good look at which specific vertebrae are twisted out, if one side is higher than the other at certain points. Just come up very slowly. Okay, so there. A little raised up there. There. Okay. I see. So, go ahead and twist back around. Alrighty, so we've got a few things that we want to work on here. So I am going to have you lay down, face up on the table to start, and then towards the end we'll have you face down. But we are going to start by working on the head and neck, work our way down, okay? Alright, I'm going to give you a minute, get all situated, and I will see you in just a second. Just going to arrange you a little bit. Make sure you are well supported here. This is comfortable. Okay. Do you want any drapery at all? Blanket? Any pillows? Okay. Alrighty. Let me just roll up the old sleeves a little bit more. And we're going to focus on the head. So, what I had said is that we would start in with the head and neck relationship. So let me just move around a bit here. Okay. Alrighty, so how we're going to work with your body. This is called Bodywork. Very simple. These are manual therapies. So for example, to start, I'm just doing a little craniosacral work where we're working extremely gently on the skull, manipulating little bones again extremely gently. Feeling the fluid, the flow. And bodywork, manual therapy, what have you, encompasses a lot of different work. For example, you have chiropractic. You have Rolfing. You have Feldenkrais method. So those two would be structural integration and functional integration. You have Rosen method. Obviously craniosacral that we're working with. And our goal is to address and correct dysfunction in the body, pain, trying to get to the root cause of things, whether it's something in the structure, the fascia, the muscles. Okay, let's just look. I'm gonna get real close here. Okay, so I'm just going to very gently press in here. We're going to try to get this vertebra to realign. This one's kind of impinging here. Okay. And on the other side here, we're going to try to loosen this up. everything is a bit of a balancing act. I'll come back in here. And I'm not really looking, that's not what I need to do, but what I need to do is look with my hands. Just palpating around and seeing what we can do. So I'm going to press in here. This muscle is pretty tight. We'll just give that a few seconds and release. If I come in from back here, if I just do this right here. Okay. A few seconds. Release. Good. Okay. There we go. That's opening up a little bit. I'm just going to move your head a smidge. Let's move this right here. Okay. Just hold right there. Let's see. Okay, that definitely changes things. So, right here. See if we can just relax a little. Good. And then let's see if that happens on the other side. So right about here. Okay. There we go. Pressing in here. Good. Okay. And then let's just bring you back. There we are. Okay. So I'm going to do a little poking around here. Just let me know if any of this is painful or tender. Okay, so nothing around the masseter, about the temporalis. Okay. Alrighty. So, I don't need to release in there. Why don't we go ahead and move on to the shoulder. So let me see the shoulder here. I'm going to take your arm, and since you're laying down, this will be a bit easier than earlier, but we're going to just rotate this. Good, and back. How is that? Okay. Put your arm down. I'm actually going to pick up your shoulder. So one hand underneath, one hand on top. And we're going to roll it around like this. And back. And how does that feel? Okay, so I'll get to the other side after this one. The shoulders, while they have a relationship with the general structure of the body, we can isolate each one. So we're going to unlock some of these rotator cuff muscles here and get a little bit more freedom in there. So let me come underneath. Just feeling around here. So we've got 4 main rotator cuff muscles. teres minor, subscapularis, but when we're dealing with the shoulder, we also have to keep in mind the trapezius, pectoralis major, pectoralis minor. We have a lot of other adjacent muscles that can be affected. Okay, in the front here, we just want to unlock these muscles and see how it affects everything else. You change one thing and there's a whole chain reaction. Okay, so I'm going to lift up your shoulder again from the back, so you'll feel it come off the table. Other hand is going to be right on front, and we're going to give this a nice long stretch here. So we're going to be really rotating this as much as it will go. We are really utilizing the entire ball joint here. And back. And nice and slow. Nice and slow. There. Now I'm going to take this arm. And we're going to do that again. So if I rotate it like this, and like this, did that change? Okay. This arm goes here. Let's look at this side. So, arm comes up, and if we do this, and that's a lot different. Okay. It's good that we have that bit of comparison. So we'll go ahead and just work in along these muscles again. There. And I'm just gonna pull the shoulder up so we can work in underneath. Work inside here. Just going to move the arm so that I can get right in here. There we go. So this one's a little tighter. And your structure was, I mean, it's certainly not the worst I've ever seen, but it was still not ideal. So it makes sense that one side is going to be trickier than the other. Okay, if I come in under with this side, then with this. We're getting a lot of movement. The table covering is trying to slip away with us. As are you. And the other side. And the other way, rather. Okay. Let me I'm gonna scoot ya. I'm gonna lift your shoulder and arm. There we go. The table covering can be a little sticky when it's humid like this. Just your skin likes to stay adhered to it. So the little covering helps quite a bit. Nobody likes to peel themselves off of leather, pleather, what have you. Not fun. So, I'm going to take your arm. And we're going to go up and in and out. And how is this? Okay. So, why don't we look at the chest here? Because we've done a lot of work around the shoulders. What often gets missed a lot of times is the front of the chest here, which is an area that gets shortened. If we slouch forward, these muscles get shorter, the posterior muscles get longer. So we're going to do some stretching here, and this is probably going to be uncomfortable. Really probably is, because these muscles are not their usual length, but they've kind of got stuck that way. So I'm using my hands to kind of traction them apart. Good. This side. Just gonna see what's going on. We'll see what's up with the sternum. Okay, right in here. Is this so underneath my fingertips? The skin feels quite tight here. Do you feel that tightness around here? Okay, and that's in these intercostal muscles here. So I'm going to run my fingers through the spaces in between the ribs, your intercostal muscles here, and try to bring a little bit of space here. Intercostals they're a pain and a half. They really are. They're very important, but dang, if you goof one up, okay, that keeps catching, so let's see. There. Just have to do it with the other finger there. So let's see right in here. Okay. When we get to the back, we'll be able to try to tighten up the muscles a little bit, which is a little more difficult. It's easier to stretch things than it is to try to make things less elastic, but we can facilitate their structure so that we can make that happen, but that's going to take a bit of work. Okay, let's see your arm now. I'm just going to take the weight of this and I'm going to just bend this in and out myself. I know you had done that, but I just want to double check. So, wrist here, internal, external, up and down, in and out. Any pain or tenderness there? Okay. So, let me put that right there. Let's just look at the muscles. That inside so we can see. There's flexors and extensors in here, and it's kind of tight. It's a little tight, so I'm going to take your arm. I'm going to move this so it's out, and your arm is laying on my lap here. Let's see if we can get into that a little bit. Yeah. We're just going to try to create some space in there. Try to open this up, and then if I turn, we'll get into our extensors here. And try to open this area up too. Okay. Now I'm going to put the arm here and we're going to do, I'm just going to hold you right here. We're going to do a little bit of traction. I'm going to pull your arm back. We're just going to create a little space between the joints. Okay. And go back again here. And again. Okay. Let's take a look at the fingers here. So why don't we go ahead and just give them a pull. Okay, so got a couple there. Can I crack them any other way? Nope, those are stubborn. Okay. A little crack, little pull. And then the other side. So, in and out with the elbow. That's okay. Alright, wrist. Rotate internally, externally, side to side, up and down, little cracking, nothing crazy. No. The upper arm is pretty good, both arms. Just, I'm gonna bring this arm over across you so I can really work into the forearm. I'll try to stretch that out. So I'm using both of my hands to just pull apart like this. And get some space in there. Good. Okay, flip it over. And just smooth that out. Okay, so as for traction here, one of my hands is going to pull the arm, the other is going to stabilize the shoulder. We're just going to pull, let it rest, pull, good, let it rest, and pull. Alright, let me see the fingers. Nope, none of those want to crack. About. Nope. Nothing else. You got some pretty rigid fingers there. We'll just give them a pull then. Okay. So, I am going to have you flip over. We're going to work on your back. We're going to work on the hips, legs, I'll give you a second to flip over, and we'll keep going. So, this side. We're also going to bring in the roller. I'm just going to set this to your side right here, because I want to focus first on the vertebrae, as well as the back of the shoulders here. Make sure these rotator cuff muscles are good. We're going to work with the lengthened muscles. And we'll use this for some breaking up of those adhesions. See if we can create that structure we're looking for. So, let me just take a look at how things are aligned here. So, This is going to need to be warmed up a little. Maybe after our roller, we'll really work into the vertebrae. Let's take a peek at our shoulders. So if I press in here, does this feel okay? How about on this side? It does, okay. And what about right in here? Okay, so this is where the muscles are going to be longer than they should be because the muscles in front are shorter than they should be. So yeah, let's just go ahead and jump in with the roller here. This will help warm things up as well. That little bit I started with. But it'll help also break up some things, make it easier for us to work in there. Other side. Get the table, making some little creaks here since we're putting a good amount of pressure on the body. Let's see what we got. Is any of this painful or tender? Good. Go back in. Smooth everything out, so I'm going to put one hand on the opposite shoulder, one on the hip, and let's just stretch that out a little. Okay. Stretch. Stretch. One hand on this shoulder, one on this hip. And stretch. Stretch. Okay. Just gonna open everything up here. Let's check out these vertebrae. So I am just going to press this one down. We're going to get some force in there. Let me know if it's too much. Okay. Right. As we just work down right in here. Good. Okay. Right here. There. Down in the lumbar, and that one, those are, let's go this side and just press that in. Let's look at the sacrum here. So, this is an area where, unfortunately, it's going to be pretty tender. So I'm going to put some weight in here and just bring my body weight down on top of it. Let me know if it's too much. Okay, we're just going to hold here. We're going to try to release the muscles. Okay, right in here. Just going to do some vertical pressure. Stack that in there. Okay. Right in here. Good. And just bringing that down. Okay. Alrighty. This is just going to be pretty tender in general. Let's see if we can get in here and maybe release a little bit. Okay. Right in here. There. Let's bring this in. Just give everybody an all over a little. Let's look at the legs here. So, let me bring this back. Back. Okay, other knee. Back. And back. Okay, so let's just rotate the ankle up, down, in and out. Rotate in, rotate out, up, down, in and out. Okay, I'm going to take your leg here. And I'm going to do some traction and let it rest. Traction. Rest. Traction. Rest. Okay. Other side. Okay. Legs are a little heavier than arms. Okay, let me pull out the toes a bit. No, nothing. I really haven't met many people that get just one or two cracks from the joints. That's a little unsatisfying, but that's alright. As for the feet, let me just see this here. We're going to do just some squeezing. Open this up. Good. Now you're going to want to take care when you do get up. You might feel a little dizzy. And I'm going to give you a minute to reacclimate. We'll see how everything looks. And the feet, I think we can make it bigger. Maybe we can go bottom to top next time. Give it a bit more attention. Okay. You go ahead and just take your time getting back up, okay? I will give you a few moments, and if you need to hold on to anything, need to take it slow, that's okay. Alright. So, I'll see you back sitting up in just a second. Let me just look at everything now that you are sitting upright. Do you feel any dizziness at all? Okay, good. That's good. You might a little bit when you get off the table, but it's a good sign that you do not currently, probably won't have any of that. So, the shoulders are certainly a lot lower. We've got a better alignment, certainly. Let me look at the hips here. Okay, we don't have that tilt, which is good. And let me see. Let me see the head a moment. Just let me take the weight of your head. There we are. Okay, so we can go straight back, and that's not a problem. Go to the side, tilt, and tilt. Yeah, no, the neck's a lot freer, and it looks like that little bit is all good, although, here, let's put you at a better neutral. There we go. There. Still a little pliable. Okay, so is there anything else that I can do for you? Is there any lingering areas of pain? Any issues whatsoever that we can get taken care of? Okay, all good? Alright, excellent. So these sort of adjustments will usually, if we work on them, let's say every week to 2 weeks, we can expect that after at least a few sessions that things will start to stick and things will not slide back into old patterns. We gotta give your body some time to learn. So, I would like to see you back in a week, maybe 2, whatever works for your schedule, and we'll tweak anything that's gone goofy at all, and we'll just keep building upon that. Alright? Okay. Well, I would like to thank you so much for coming in to see me. I'm glad we were able to get everything adjusted. I hope you have a whale of a day and a good rest of your night. Thank you. Energy is in all things. Your brain, it's a ball of fat powered by electricity. Everything is energy. The feeling you get when you hold your hand so close to something, not yet touching, but you can still feel the heat radiating off or being leached from your skin. Energy. We have some particular protocols for each level of energy infusion, but we're gonna have to take a little scan of your energy levels before we get into that. Just taking a preliminary little look show you what we're looking for. This person right here shows us some of the signatures that we might find in a person when we're looking at their energy. We have our energy just above the surface of the body. We might find holes, spikes, areas where it's more normal. We might have concentrated areas where it's very thin. And along the surface of the body, spikes, concentrations, gaps, so on and so forth. And we'll look at each level of your energy from above the body, the surface, just below the skin, deep in the brain, and the energy lines along the body. So I'll have this little blank guy to help with that, as well as our little colored pencils. So I have two tools for this. First, I've been using my hands to get a good look, at least just to start, but we can also use a little scanning tool, but both of these are not going to be as effective if we don't amplify, if we don't give your energy a little spark, a little charge. So, let me see. There we are. You know how solar panels work, right? At a basic level, where they absorb the energy of the sun to charge a battery, to then give energy, right? We see those with little solar-powered lights where they use the energy from the day to light at night. Or even if we think of glow-in-the-dark stars, or even those little glow-in-the-dark rocks you put outside, they absorb energy so they can release it later. And that's what we're doing here. We're just giving your energy a bit of a charge so that it can release some of that energy and become much more vibrant. There. So let's see what we got. Just looking at the surface here. Let's see. This is going to be our color for that. So we're looking at that. We've got right here at the head. Okay. And along the shoulders here. Down the arms. Right there. Good. torso. That's certainly going to need a little bit of work. Now, looking along the surface, so I might just touch you a little bit, if you don't mind. Helps to pick up some of that energy. It feels a little staticky. Okay? Alright. There we are. Good. Do you know our fingertips are so sensitive that if we were to touch the earth, the entire earth, our fingertips would be able to feel the distance between individual houses, even on a scale as large as the entire earth. Very sensitive. Our mouths are more sensitive even than that. It's why babies put things in their mouth to get information, because it's more sensitive than their fingers. Just feeling around here, just taking a little feel. I'm just doing these quick little swipes. I can get a good reading, and we have orange for our surface, so picked up quite a bit here at the face. Nice big concentration here. Yes. Okay. Not so much here, but yes, in here. Mm-hmm. Rather weak overall. A good distribution, but not great on the thickness of everything, so get a little bit more info. Luckily, the energy inside can blend together a bit. So we're just going to grab this. And I'm just going to have you hold still here. And we're going to get a reading of the brain. There we are. You're doing excellently. Excellently. And along the meridians. And down. Yes, and I'm going to get deep. inside the bones, muscles. Yes, I think that'll do quite well. So I've got a little screen that can tell me. So this is the brain. And this is our deep concentrations. Just under the surface, which isn't too bad, it's just got a lot of gaps. Good. Our lines here. A little kinked up here. Okay. Let me show you what we've got. So, this is your workup here. So, brain's a little scattered about. Our lines here, very disjointed and kind of kinked. Some gaps and low energy outside. The surface energy is barely there. Deep energy is all over the place, although there's a nice concentration right here. And just under the surface is pretty decent, but just a lot of gaps. So let's put this away and get to work. Now, just for simplicity's sake, we've named these different steps, these different types of energy that we infuse, just alphabetically. So I'm going to need some light to help replenish for our A waves. So our A waves are just along, or just above rather, the surface of the body. Charge it up a little, because even though we had charged your energy before, it was pretty pale. And this just helps disperse what we've got going on. There we are. Sometimes it helps to stimulate with a bit of sound. We'll just do a little. Nothing too crazy. But then we can do some light tapping to help stimulate everything. easy to get our A waves in order. And just kind of scan over. See, this is where I can feel that energy as it radiates off, and it's actually my energy that's radiating. Yours is pulling mine in like a cold area. It's cold in that it is pulling energy from heat, leaching it. Good. Yeah, A waves are pretty simple overall. The other ones get progressively harder. Okay. Well, let's move on to B waves, and we're going to need the assistance of a little substance here. B waves. B waves are on the surface of the skin. So we need a little bit of friction here. We need to create a little bit of heat. We're going to have to probably do some replacing here, going off of our guide. Okay. So, on the skin, what my job here is to do is to pluck out bits and replace them. Need a little bit of heat along the way, because this is going to help establish a foundation of energy. Just pulling and releasing. Yes, B waves. Releasing. Good. And just get rid of all of that. This is where we start gently infusing our energy back. So what you had just was not cutting it. I'm just going to use my fingers and gently resurface. And I'm only using the 2 fingers so that your energy, as it pulls from mine, can only take this little bit. It's like, instead of dumping an entire bucket in one spot, you use a little spout or a nozzle to control the flow. There. It's running all over your head here. There we are. How do you feel any sort of sensations? A common one is, of course, going to be heat. You might experience tingling. You might even get a little bit of cold, as I would pull out bits of the energy. Anything like that at all? Mm-hmm. Just using my fingers to just give you little strands of energy that you use to weave together and create a stronger barrier. Good. Okay. Now our sea waves is going to go right underneath the skin here. So we're going to need something to open everything up a little bit. So we're going to use some special mist here. And that just allows us to get a little deeper just underneath the skin. So I'm going to hold my hand over your face here just so we can get a little bit of mist going. Should do that, at least just for now. Let me look and see. Just as the mist falls on the skin, it creates these little pockets where we can press the energy in, and it goes right down into where we need it. So for our sea waves, we are going to be pressing our energy in, pressing it in. And we might just do a little kind of stipple here. Stipple. Might even use all of our fingers here just to stipple in. Just to stipple in the energy, but for now we'll just press that in. Press. Just like that, picking strategic points according to your chart to press in our energy. And luckily this is a fairly thin layer. Press. That I can just use single fingers Just like that. And maybe right in here. And right here. Right here. Press, press, press. Press, press, press. Just like that. And then we can stipple everything. Stipple, stipple, stipple. It's a little difficult to stipple without a brush. But we're basically just doing these little tapping motions. Each finger has a different pressure, a different shape, a different size, so that the energy is quite varied. Just like that. Right at the throat here and down to the chest. These little stippling motions on the arms. On the legs. There. Now, this is where we get even just a little bit trickier. For our D waves here, we actually are going to employ the use of a crystal. So, let's see what we've got. Need something with a good point. We have a little agate shard, for example. And then maybe there's actually quite a bit of agate in here. This is a banded agate, I believe. That one's a good candidate. Carnelian, maybe. There we are. There's one last one. I like the striations in this one quite a bit. So we just need to see what your energy responds to. So I've got a little reflex hammer here, and this will be advantageous for us. So. Okay. Possibly. Not so much. Better. Let's run her up. Definitely not. So, this was a maybe. I like that one. I How about you? Yeah, let's use that. So, like with the poking and the misting, I need to be able to create little pockets in which we can go deep into the body. That's what this is for. Call it a bit of crystal surgery, if you will. I'm just going to go around poking these little holes. It's almost like aerating the lawn. You've got to give some entry points. So we can get that energy in. Luckily, we've got this rubber mallet here so that we don't damage the crystal and we don't do any damage to your energy. And we'll do a couple special spots here. There. Now let me draw some of this out. Because we had some high concentrations. Remember, we particularly had one in the shoulder here. Pull that out. Just draw all this out and start again. Now, because this energy is neutral, is universal, it might feel a little strange as it transforms into something specifically your energy, as it morphs and changes and gets with the program. It's gonna feel a little odd, almost like wearing someone else's clothes after wearing them for a certain period of time. Then eventually it just feels like yours. But that first little bit's odd. I suppose I should say wearing a stranger's clothes. Alright. Created some access points, got rid of some things, so now we're going to do a deep push. 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 Deeply pressing energy in, and this is where we got the 5-finger touch here, because it comes in short little bursts, so we've just got to press that in as best as we can. There we are. Press that in. Good. And just basically, we're throwing darts at the wall and seeing what sticks. That's why we've got to go big. Not everything will get into the little access points. So we're just flooding it. There we go. Good. And we've just got a couple more waves to go. E-waves. We're going to do a little bit of tapping in, and I'm going to use this little wooden tool for that. So again, access points, but we need it a little deeper. Deep into the brain here. A little bit of rubbing. It's almost like exfoliating, really. Massaging the energy into the brain. And then, let's see. There we go. F waves, these are along the whole body, that's those meridians. I'm going to use my fingers like rakes or combs and trace the lines to open them up. Follow them up. Let's press in our energy, flooding the area. The arms, even into the head. Okay. let's take a look. Just kind of look in here. It's a lot more vibrant, so we don't even need to really use the light to charge anything. We're just looking here along the surface. Legs, torso, the arms. And let's get a good little map. Around the head, just hold still. Deep into the brain, meridian lines, skin surface just below. See any concentrations. See what we can do there. Okay, so looking at your before chart, we've definitely evened things out. The outside is more vibrant, but it also isn't so spiky in places. There aren't any gaps underneath. The meridian lines look a lot cleaner. It's like someone just came and straightened them out. Brain's more contained. Yeah, no, that's pretty darn good. So, that concludes your energy infusion. We were able to straighten things out quite nicely. So, might feel a little weird while your energy fuses with yours and becomes yours entirely. Other than that, you should feel a whole lot better. I'd like to thank you so much for allowing me to do this infusion. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.